is right to go. First things first, there are 19,336 aggregate cases of coronavirus in Victoria over the entire pandemic. That's 113 new cases since my update yesterday. There have been, I'm sad to report, now 591 Victorians who have passed away as a result of this global pandemic. 9 of those deaths occurred prior to yesterday, 8 of them in one facility. So as we foreshadowed a number of times this week, there will be, because of mandatory reporting changes and the reconciliation of data between different agencies, there will be from time to time deaths that have come in from previous days, and we'll report those to you faithfully. Our thoughts, of course, and our best wishes are with, and our sincere condolences are with each of those families. They include 4 males and 3 females in their 80s, 2 males and 6 females in their 90s. 14 of those 15 deaths are linked to aged care outbreaks. There are 361 Victorians that are currently in hospital. 20 of those are receiving intensive care, and 15 of those 20 are on a ventilator. Now, a total now of 2,331,261 test results have been received. That represents an increase of some 82,309 since yesterday. But let me just take you through how we account for that very substantial jump. As you know, some weeks ago, many weeks ago in fact, we moved to an exclusive focus on positive test results. They are, after all, the people that we want to get to as fast as we can, have them isolate and have the appropriate public health response. This jump in tests is largely attributable to a very large batch of negative tests that have now been brought to book and included in the overall total. But yesterday's tests, so the normal number that I would report to you, is in fact 17,098. That's the results that have been received in the last 24 hours. And can I just thank each and every one of those almost 17,100 Victorians who yesterday got their results because they had gone and got tested a day or so earlier. That's a really impressive thing. Those numbers are up again at I think a level that gives us a greater degree of comfort. We're very grateful to each of those people, and again I'll send that clear message and that clear request to every single Victorian. If you've got any symptoms, even the mildest of symptoms, please come forward and get tested at one of the more than 190 test sites across the state. It is critically important, central in fact, to opening up, because it is at the heart of us understanding and having the clearest picture about how much virus is out there, chains of transmission, how the virus is behaving. There are 4,361 cases with an unknown source. 24 of those investigations have been closed out and added to that total since yesterday's report. There are 337 healthcare workers who are active cases. We send our best wishes to all of them and thank them for the amazing job that they're doing as the last line of defence for all of us against this widely infectious virus. And there are some 2,295 active cases across Victoria. In regional local government areas under stage 3, so the regional split is 126 cases, so those numbers are low and are staying low, and that is a very good thing. Those communities that we had significant concerns about some time ago: Greater Geelong, 38 active cases, just 2 new overnight; Greater Bendigo, 9 active cases, 1 new overnight; and Ballarat has 4 active cases and no new cases overnight. I don't have an aged care active case number for you. That will be in the Chief Health Officer's release a bit later on today, but I can confirm that there are now 3,704 shifts that have been filled in aged care facilities by hospital staff, and we're deeply grateful to each and every member of that hospital team that has gone to residential aged care, providing care and support exactly what's needed, and that's what's brought, in the main, that's what's brought a sense of stability to a sector that was in absolute crisis. In terms of active cases in disability facility settings, we have 34 of those. They are 22 staff and 12 residents, so that is stable and indeed falling, and very important given the vulnerability of those residents. Before I ask Alan just to speak to the epidemiology of the day, I just wanted to address some reports today. Sunday is the day that the government will announce our roadmap, both for metropolitan Melbourne and different settings for regional Victoria. The documents that have been the subject of a lot of interest over these last few hours, are out of date and have no status. We will on Sunday give people a clear roadmap with as much detail and as much certainty as we can possibly provide. It won't be guided simply by dates on the calendar though, it'll be guided by the science and the data. It'll be guided by how many cases there are in Victoria and the types of cases. There is an enormous amount of modelling going on at the moment. That does take quite some time. Literally thousands of scenarios are run through various computers and processes, and that does take some time. Sunday's the day when we will have much more to say and be really clear with the Victorian community about what the next steps will be. I've said many times, and I will make the point again, this has got to be done in a safe and steady way. I know everyone wants to open up tomorrow, I understand that. But if we were to do that, these numbers will explode and we will have a couple of weeks of sunshine and we will be back most likely in an even worse position than we were 4 or 5 weeks ago. I know it's frustrating, I know it's difficult. There's only an acknowledgement. We absolutely understand that. There is no question about the difficulty that these settings, that these rules are causing. But at the same time, my sense of it is that Victorians who have given so much, they want what they've given to count for something. They want it to mean something. And it will mean precisely nothing if we open too fast, if we open too much too soon. We will just see these numbers explode and no sense of control whatsoever when it comes to this virus, and then arguably an even worse set of circumstances than we confront today. That is not going to happen. We're going to do everything we possibly can to make sure that does not happen, because we've got to defeat this second wave properly, so that we don't simply begin the process of a third wave. The aim here, and one that I'm confident we can achieve all of us together across our state, is to ease out of this stage 4 in a steady and safe way, find a COVID normal, which will take some time. It's not something that occurs from the 14th of September. It's not an instant thing where you can simply move to essentially a normal. We have to find a COVID normal and then lock that in with the aim of those settings remaining in place for 2021, or indeed until we receive a vaccine. That's the status. There are no announcements to make today in relation to the easing of rules. As I foreshadowed on Monday, that'll be laid out in as clear and as certain terms as the science and the data allows us to on Sunday. I now might ask Alan just to add to my comments, and then of course we're happy to take any questions you have.
Thanks, Barry. I do have 2 of the figures that have just come through. So there are 97 active cases in aged care outbreaks, and a total of 447 deaths in aged care. So we're keeping a very close eye on a lot of Victoria. As the Premier's just mentioned, there are 9 cases in regional Victoria. Within metropolitan Melbourne, within metropolitan Melbourne, Brimbank had 9 cases yesterday, Casey 10 cases, Hume 10 cases, Wyndham 18, and Moreland 3 cases. These numbers obviously go up and down a little, but we're keeping an eye on a long-term trend there. So happy for any questions.
Those cases, you able to give us any more breakdown about if they're in workplaces, community transmission? Have you got any early indication of where this is? I mean,
so when we first hear about them, we obviously don't know, and we need to close out the case investigation. There are 10 cases that we know. There are. Actually, I don't have that number, but there are certainly 10 cases in the increased, an increase of 10 cases in the unknown source, but that reflects from a few days ago. And we're just working on obviously, because it's not, the denominator is not yesterday's cases and the unknown cases are from a few days ago, we're just working on a report to just make that a bit clearer.
Are there any trends in the cases that you have identified as being linked to known outbreaks in the past couple of weeks, as far as coming from particular industries or settings?
Look, I think all the high-risk industries that high-risk workplaces are the ones we worry about. So obviously, healthcare and aged care as the major ones, but we also worry about abattoirs and meat works and other places with chilled areas. But I think there are really quite a diverse range of workplaces that have been involved. And really just reinforces that all workplaces need to have COVID-safe plans and be prepared for what might happen if they do have a case.
Do you have an idea of how many healthcare workers are in today's figures?
So there are an increase of 35 cases as of from the last 24 hours, and that's 3,241 in total.
That's a lot. That's like a third, isn't it?
That is a large number. Again, we don't always know at the very time, when they're notified exactly if they're a healthcare worker. This often represents a day or so, but it is a large part. Just to reinforce, healthcare worker is a large category, so everyone who works in a health service, everyone who works in aged care is considered a healthcare worker. But it's very important that we protect all of those.
Given we're seeing
an outbreak in the Latrobe Valley, are you able to give us much information about that? I understand it was a local man who went to Melbourne, came back infectious, and has visited a few shops. Is that a cause for concern, given that?
Yeah, so that we're certainly keeping a very close eye on the cases in southeast Melbourne and Latrobe LGA. That person did visit a number of places, and those the times and the dates that the person was at are listed on the Department of Health website.
Just with the numbers, and given that 35 today's numbers are from healthcare workers, even though the numbers are going up, does it give you some confidence that you know where a lot of these cases are, and when you're looking at easing restrictions, given it may be in one area, does that give you a bit more confidence to open up maybe the wider community?
Oh, look, I mean, they still are distributed through. I mean, I've just read out sort of 5 LGAs where there are a lot more cases, but they're certainly distributed throughout Melbourne. I mean, it isn't always easy to sort of pick that out, because this is the place where people live, and obviously they may work in a different LGA. I think, I'm reassured that the number of cases is coming down somewhat. It's not as low as we would like it to be. And I think, what's happening in the regions is probably, a trial run for what might happen in Melbourne, where we get down to, single digit numbers. We are starting to, turn our attention to trying to do very extensive case interviewing, making sure that there's a lot of investigation around each of those cases, and a lot of investigation, tracking down to, for example, with the case out in Gippsland, working out where exactly the individual had been. So when we get into that situation is where we are starting to become more confident that we're starting to close down trains of transmission.
So the number of cases in the regions actually rose today. Obviously, yep. it's a low base. There are 125 cases yesterday. There are 126 today. But how concerned are you that it's kind of going in the opposite direction?
Look, it's not a day-by-day thing, but certainly we want numbers to continue to come down if we can. Yesterday there were 9 cases. I can't remember the day before that, but it certainly hasn't been going down as quickly. But really, when you get down to small numbers, chance plays quite a large role. It's who those last people are, and we really encourage people to come forward for testing so we can pick up these chains and then shut them down. So, as an example, if they, we might be starting with a small number of cases, but if one of them, is in a household and transmits to the other, then it'll look like a big jump. So we need to look at the details of those cases, not just the sort of the raw number there.
More broadly, today's the first day since the peak on the 5th of August when the 7-day daily average hasn't fallen. It's the same as it was yesterday. How concerned are you about that trend?
Again, it's sort of not a day-by-day thing, and you said the average
isn't day by day either. So
yeah, so I mean, what we're looking for is a long-term trend. So when I started work here, we were now seeing 700 cases a day. We're down to an average of about 100 cases a day. That's substantially lower, but we need it to be again another magnitude lower before we start taking the next steps.
There are 9 more deaths today that occurred some time ago prior to yesterday. It's been every day this week that there have been this catch-up of deaths that have occurred some time ago. Why can't the number of deaths be reconciled in a 24-hour period?
So some of these, as I understand, were occurred before Brendan Murphy wrote to all the aged care facilities to mandate reporting. So there is a process where they are, we're reconciling people who have passed with the Commonwealth. I think some of these deaths weren't notified to either, and we're also checking with the Victorian Death Registry, which obviously registers other deaths. So there is a process of checking. It doesn't change the fact that these people have passed, and obviously that's a very important process to get accurate numbers. But we will probably continue to see a few of these historical deaths
Are you
being
able
reported.
to say which facility it was that the 8 were attributed to?
I don't think I'm able to say that, but we'll get whatever we can release to you.
And if we can't trust these facilities to, promptly notify authorities that they've had people die from COVID, what can we trust them to do?
Yeah, look, these were before death reporting was mandatory, so we would be more confident now than we were then, but we're also going through checking processes with the Commonwealth, with doing audits of these facilities, and also checking with the Victorian Death Registry, where obviously it's a legal obligation to
When do you
report
think you will
deaths.
be able to catch up the total number of deaths that have occurred previously?
I don't know what I don't know, but we would hope that in the next few days we'll be able to sort of catch up with a lot of these things, and there's still ongoing processes, and even after we've caught up we will still be doing checking to make sure that we haven't missed anyone.
To catch up with the tests, does that suggest that perhaps those days that we were worried about those really low numbers perhaps weren't that low after all?
Probably not. So some of these, so the most of these tests relate back to the 31st of July and the system that had changed on that day. A smaller number, about 17,000 tests were received from a lab and in the regions, and that probably does explain some of the lower testing in some regions, but they were all actioned, so all those patients got their test results, and all the positives were acted upon.
Just on testing, is it time for Victoria to look at other point of care testing, serology tests, not to replace PCR, but to complement it in a time of screen and confirm regime to get those numbers right up?
Yeah, so just note there's two types of tests. There's the ones for active infection, so the PCR that we use now, and then there's serological tests which tell you if you have been infected, but not if you're infected at this point in time. So in general, the serological tests aren't particularly helpful for public health reasons. They sort of, they're helpful for interest and so on, and for research. There are a number of tests that are being developed that are what's called antigen tests and what's called a LAMP test. They're not quite ready for prime time. You really need to sort of know how good they are and how accurate they are before you deploy them, and that work is being done now, and I think it's in a fairly advanced stage. They are potentially game changers, so they're a bit like a pregnancy test, I guess, where they're potentially available and available to at the point of care. But we really do need to know that they work and they're accurate enough for their purpose.
Could antibody tests have a role when we open up, or just to do checks of communities, checks of workplaces, for example?
Yeah, so probably not, at least not the antibody tests that are available at the moment. The issue is that if we tested everyone here, there would probably be a couple of false positives, and we don't want people to have false positives thinking, oh, I'm immune, or I can do what I want. And that false positive rate is a bit unacceptably high for most of the point of care tests that are out there. But there's certainly, there's obviously ongoing work in development to try and make them more accurate, and when they're sufficiently accurate, they may find a place.
The draft plan indicates that there should be 5 daily cases with only 3 mystery cases for 14 days until we can go into stage 2. Is that on the advice of health authorities, and is that still current?
So that document's really a working draft from some time ago. We, as you would expect, we do a lot of planning in advance, and we're continually refining, targets and things like that. That document doesn't, as I understand, doesn't represent any decisions that have been made, and came from, it's an internal working document.
Has that threshold changed?
We're always considering thresholds, and part of it is about modelling risk. So how many cases does it take to be an unacceptable risk? And obviously it's a continuous thing. So
So are you aware of a change to that particular threshold at this point in time?
I can't speak to that one exactly, but there are continuously changes. We've been meeting late in the night and debating whether it's 10, 5, lower, higher.
Have you seen a plan since the document that's printed in
I've probably seen dozens of plans since, and I can't speak to them. They'll be announced on.
Fairly similar.
I think the themes are the same, but we're not going to make any final decisions, and we'll announce them on Sunday.
Is it likely?
That document's old. How old do you think that document is?
I don't know. I did look into it to try and work out, but there are literally dozens of documents, and I couldn't work out which one it was.
Do you think it's likely that Victorians can expect to be leaving lockdown in any form from the 14th?
Look, I think the Premier will announce this on Sunday.
That document, I think, mentioned a threshold of an average of 3 community transmissions a day over a 14-day period. Would you be comfortable with a threshold any higher than that?
Look, I think, as I said, it is sort of a continuous risk. So the total number of cases sort of represents what we call the downstream risk. So what is the chance that any of those active cases will transmit on? Unknown cases represent an upstream risk. You don't know where they got it from. So both of them are important. And it is sort of the epidemiology at the time. So, if, we had a number of days without any community transmissions, on the last day we had 10, then, whatever threshold had been set, we'd be obviously pretty nervous about that. So it is sort of, we need to look at these, figures each day and look at where we are each day. And the exact thresholds and so on will be, matter for decision at the time.
And obviously our ability to reopen is very much dependent on our contact tracing capability, which to some degree failed after the first wave. How confident are you that contact tracing capability is up to scratch this time for us to safely reopen?
There's been a lot of improvements to contact tracing over time, and it's this continuous improvement. We do know that we can, we at least make an attempt to contact everyone at least twice within the first 24 hours after being notified, for a variety of reasons, wrong numbers and wrong addresses and so on. We're not able to contact every single person, but it's over 90%. We're trying to door knock people to make sure that they know their result and get their result and know what they need to do, and also to see if they need support. So there's a lot of work going into trying to make sure that all positive cases are tracked down as quickly as possible.
Bill, that's 113 new cases today. It seems that it's an uphill battle to be able to get out of stage 4 on the 13th. Would you agree?
Look, I think numbers go up and down. We've had a couple of days in the 70s, and 113 yesterday. It doesn't really say what it's going to be tomorrow. I think the overall trajectory is that it's coming down. But as I said before, when we start getting into smaller numbers, probably smaller numbers than these, chance does start to play a bigger and bigger role. So who those last people are, and the regions are probably a good example of that. Numbers had been coming down, but one person transmitting to their household, or one person that has been to a number of places and potentially infected a number of others, it can make the numbers go up and down a little bit, and I think that's still what we're seeing to some degree in metropolitan Melbourne as well.
If numbers are concentrated in certain communities and parts of Melbourne don't have any community transmission or cases, could we move to a stage where we go back to localised lockdowns so the rest of Melbourne can start
Yeah, I think everything's on the table, but I don't think that will probably be possible. I think people move. Mobility within Melbourne is fairly high. And at the moment we are still seeing, even in LGAs that don't have many cases, we're still seeing some cases in all of those. So I'm not sure that we'll be in that position again.
Are you able to expand a little bit on how all these negative cases have come into the figures? How does that work? Why
Yeah,
are they
sure.
steadily thrown in every day with the positives?
So on the 31st of July, there was a conscious decision to split the negative and positive results from each other, so that we could more quickly action the positive results. But at that time, on the 31st of July, there were some results that had banked up in the system, and they're the ones that have come through. So all those people got their negative results, all the positives were actioned on that day. So it doesn't change anything that happened to the people that got tested. But those, after reconciliation and after everything had happened, to check these results, they've now made their way into the system.
Was that just a policy decision, or was that because of a
Oh,
lag in the labs?
No, it was a very so that relates to what was it? 48,294 results, and then another tranche of negative results came from a single lab, and they again were negative results. They were people that had received their results, but the results hadn't been notified to the Department of Health at the time.
Well, there's been another case in Gippsland at a nursing home. Do you know how they got there, that case?
I probably can't speak to the individual cases at this time, but we'll see what detail we can get you.
The bill before Parliament has a slight change in wording in it that allows, under the new state of emergency, for the Chief Health Officer to make an order even if there's no to very few coronavirus cases. Was that necessary, or do you need that in order to keep people in some form of lockdown, for example, a stage 2, if we have very low case numbers?
So the state of emergency allows for quite a lot of powers, as you know, and one of those, for example, is the power to quarantine people to make sure that they don't continue to work, for example, and that's part of the directions. So without directions, even if there were very small numbers of cases, without that we wouldn't be able to say, for example, someone who's a close contact can't go work in a hospital or an aged care home, so and they need to stay at home. So these powers are needed even at small numbers, even though they might seem to be small numbers, to stop them becoming big numbers. So
we have that power under the state of emergency that we currently have in place, so why did it need to change for the extensions?
Okay, yep, thanks.
Alex, I think in recognition of the fact that we have had a first wave, a second wave, and we're going to need to get into a holding pattern, if you like, that COVID normal, it was deemed by the Chief Health Officer and others in the public health team that threshold needed to be low, so that we could there could be no doubt that safeguarding that COVID normal may mean that there are some rules that have to stay in place even if we had days where there was zero. Because even on a day when it's zero, that's zero positive results from whomever has got tested that day. That's not to say that you could ever definitively say there are no cases in our state. And that's part of the challenge as well. Even with good, strong testing numbers that are above the World Health Organization recommended number, there will still be cases out there that have not gone and got a test. There will still be positives out there that we don't know about. So I suppose it's just an abundance of caution, because you wouldn't want a situation where you couldn't meet some threshold on known data when there were actually cases out there that hadn't gone and got tested, and then all of a sudden rules had to end, for instance, or there was some uncertainty, and then numbers blew out. There's nothing more or less than that.
Premier, I'm sure you've seen the vision of a pregnant woman being arrested in Ballarat at her home for posting something on Facebook.
I haven't seen the vision, but I have heard about the issue.
You haven't seen the vision?
No, I haven't seen the vision.
It's going viral. She was arrested in her home. She was pregnant.
Yep,
She's a
I'm
mum.
aware of that. Yep.
She allegedly wasn't allowed to have a lawyer present. She didn't know what incitement was. she posted something on Facebook. Allegedly, she was planning a peaceful protest. Do you think it was a fair arrest?
Well, what I'd say to you is I've not seen the vision. I don't know what, I'm not sure any of us know what she was attempting to incite allegedly. What I can say though is Victoria Police will be out I think a bit around noon, if not a bit earlier, and they'll be able to speak to all of those matters.
Was
Is
it
there a new
heavy-handed?
policy on approaching potential protesters in this way?
Not that the government is involved in. That's very much a operational matter that Victoria Police, they may have made some decisions on the ground, as it were, but that's not something I can speak to. But they are going to be out, and you'll be able to put those questions to them.
Do you think it's heavy-handed?
Should the organisers of the Black Lives Matter protest have been charged with incitement, given that they were also planning a protest at a time when we were under restrictions and 10,000 people attended?
I would need to refer you to Victoria Police in relation to what occurred with those people. So I'm not sure whether state of disaster versus state of emergency may have been a relevant factor there. I don't know the answer.
You supported their decision at the time not to do anything more than charge the three organisers, or to issue 3 organisers with fines for breaching COVID restrictions, and not to penalise anyone else who attended, though.
Well, I'm very clearly on the record as saying that those are matters that Victoria Police should have absolute control over. I don't.
I guess you
I
supported
don't
their
think we ever.
decision on that occasion. Do you
Well,
support
let me
their
finish.
yesterday?
Let me finish the answer to the question, then I'll answer the next one. It is not my practice to be directing police on how to enforce the law. That really is a matter that I think they need to have that absolute sense of control, with the full benefit of any context that may or may not be there with any given case. In terms of your second question, I think that Victoria Police will be out very soon, and they'll be able to speak to these matters. And again, that's probably the best way to go, rather than me offering opinions. I'm not fully briefed on the circumstances involved, and the people who are, and the people who can potentially answer those questions. I'm not for a moment diminishing that it is of very significant interest, not questioning that, but the details, they are known to Victoria Police, and they'll be able to potentially speak to some of that.
Obviously, the Black Lives Matter issue was something for which there's a lot of community support. People going out and protesting against COVID restrictions is something for which there's not very much community support, I think it's fair to say. But should you know, I guess we live in a free society. Should what the issue is about play any role in what penalty people receive for
No.
organising a protest?
No.
Yeah.
The worthiness of the cause or otherwise, which would ultimately be something that each individual would have to make their own judgments on anyway, because something that you and I, Rachel, might take to the streets to protest about might not necessarily be something that someone else would think was worthy of us taking to the streets. The key point here is now's not the time to protest about anything, because to do so is not safe.
Premier, the British Medical Journal says the risk of COVID transmission is low if everyone is masked. It's outdoors, and then everyone keeps 1.5 metres apart. So if that's the case, why can't they protest?
Sorry?
If that's the case, why can't they protest?
Well, the British Medical Journal article you refer to, which I've not had the time to read, is a matter for the person who authored it. The rules in Victoria are that it is not the time to protest, and that's been my consistent view, regardless of what you're protesting about. And I'm not making a comment about the worth or otherwise of whatever someone's protesting about. That isn't the issue here. When you're trying to drive these numbers down to the lowest possible level, then if you just took that example one step further, or the point you make one step further, well, what if 1.5 metres isn't maintained? What if one person isn't wearing a mask? What if someone's not wearing their mask properly? Like, all of these things, they're unacceptable risks. You don't need to protest, but we do need to get these numbers down so that we
you
can.
don't trust people who would be protesting.
Well, if Sky News is advocating that I should change my position and protest should be allowed, well, it's an interesting day then, isn't it? Because my position will not be changing. With the greatest of respect, I don't quite understand the point of the question. There are rules. We're not going to change those rules. Protests are not smart, they're not safe, and they're not lawful. And that's where it's at. Others in London may have a different view, but that's That's entirely a matter for them. And I just made the point again, it's not about what you're protesting for or against. It's not about whether you might, in a theoretical model, as you've put to me, devise something that was safe. You don't need to be doing that. And if you do, there's an unacceptable risk that you'll compromise the strategy, which is to drive these numbers down as low as we can get them. And it will, as Alan indicated, it'll get to the point where, ones and twos and threes, really small numbers will be critically important if they're not contained. Because, as we know, even one person can infect many, many hundreds.
113
Those rules
cases.
should be applied evenly regardless of what people are protesting about. Why do we have a situation where 10,000 people were allowed to attend a protest without being penalised, and a woman's been charged with incitement over allegedly posting something on Facebook?
As I said before, I'll let Victoria Police speak to the circumstances of the incident. I'm not diminishing the importance and the significant interest in that matter, but it is a matter for Victoria Police. In terms of historic matters, so things that have happened many months ago, Victoria Police made a judgment, and that is entirely the very difficult job that they have to do. We can't change that, but we can certainly try and change the behaviour that anybody might exhibit over the weeks and months to come that might put everything that we are, all of us as Victorians, working to achieve, and that is the lowest possible case numbers, a safe and steady easing of restrictions, and then a COVID normal that we can lock in for months and months and months, hopefully, all the way through 21 until we get the vaccine. Everyone will get a go, as you've always all got to go. And why don't we'll go that way. Laurel.
Is stage 4 restrictions going to continue past September 13?
I can't rule out that we have to continue rules. I simply can't. Everything's on the table. Will be driven by the data and the science, how many cases there are, the types of cases there are, and some modelling. It is a very big exercise. You've got computers with amazing amounts of capacity running hundreds and thousands of different options, coming back to us with a series of risks. So if you do this package of changes, there's, say, a 50% risk that cases get away from us again. If you do this package of changes, there's a 35% risk all the way through. It is a big job, and when Alan says there are meetings, there are literally hundreds of meetings going on. We had one last night that wasn't finished till after 11:30 or something along those lines, and then a heap of phone calls and follow up after that. So there's a power of work going on, and we're going to try and bring as much certainty to this as we can. But you've got to err on the side of caution. You have to assume there's more virus out there than what we're getting the test results for. That logic and science tells you that. And the other thing too is that we've got to find a way to see this through, because if we give in to this thing, and it's stubborn, it's not going away quickly. If we give into it, then all the work that we've all done will be worth nothing, absolutely nothing, and we'll be back to 600, 700, 800 cases a day, and we just can't have that, because we know that with 500 or 600 people in our hospitals, that puts a lot of pressure on, perhaps more than anyone thought. It wasn't a matter of being prepared, absolutely prepared, but when you start getting hospital-based infections, which is a commentary on how infectious this is, you get staff that are sick, you get staff that have to be furloughed. It's challenging, very, very challenging.
We shouldn't expect life to change after September 14.
Well, I'll make announcements on Sunday about what the next phases will look like in the weeks and months ahead.
In terms of giving people hope, should they get excited about something changing on September 14th?
Well,
is it very likely that life will continue?
I'll leave people's excitement levels to others to determine. They can determine that themselves. What I'm about, though, to be really clear, I understand why I ask questions, perfectly reasonable question, but I can't, standing right here today, give you details of a series of decisions that haven't been made yet, outline for you advice that has not been finalised yet, or a series of rules, because that will be for Sunday. And on Sunday, we won't necessarily be able to answer every single question. I won't necessarily be able to tell every Victorian what December's going to look like in fine-grained detail. That's not the enemy we're against. We're up against something that moves really quickly, is highly infectious, can be unstable. In general terms, the trend, this strategy is working. Numbers are coming down. We will see days jump around a bit. But if we all stay the course on this, then everything we've given, everything we've done, every sacrifice that's been made will count, and it will count in really big terms, because it'll mean we can lock in a normal rather than bouncing in and out of restrictions and ultimately saying that everything Victorians have done is worth nothing. I don't want that. I do not want that. And that means it is frustrating, I know. There's much frustration in many different ways. That's the nature of this thing. Sunday is the day when those announcements will be made.
113 cases.
Lundy and then Rich.
Are you factoring in the level of community frustration and the fact that you probably won't get a third go at this? That if it does get away again, the state won't tolerate a third lockdown, so there really is pressure to make this one count, as it were?
Lundy, I think that in trying to come to... Well, I'm happy to be completely frank with you. These are some of the most difficult decisions that I've ever made in 20 years in public life. And I've been blessed to have lots of different jobs, lots of different roles to play. These are really challenging decisions to make because the tolerance for getting it wrong is incredibly low. And what that means is that I will not do this faster than the science tells me to, because there's too much at stake. And that's not to say that being in lockdown doesn't have its own cost, doesn't have its own sense of pain and challenge. I get that, I understand that. None of these decisions are made lightly. But my sense of where Victorians are at, frustrated, yes. Not particularly pleased to find ourselves confronting the reality that we confront. But people want all that they have given to count for something. And it will count for precisely nothing if we open up too much too soon. That's just a fact. Now, whether people agree with that or not, the responsibility I have is to do this in a safe and steady way. And that is exactly what I will do. And whether it be popular or not, that's not the issue today or for the foreseeable future. It's about doing this right. And people can have different views. That's a healthy thing. That's perfectly fine. But I don't get the luxury of doing what might be popular. The task that our team has is to do this properly and to make sure that after a gradual, steady and safe easing of these rules, we can find a normal that we can lock in for months and not be bouncing in and out of restrictions, because that just does no one any good. On the issue of contact tracing, I would just say this: you've got to make sure that it's a fair fight. Like, no contact tracing team anywhere will be able to defend against 600, 700, 800 cases while the place remains open. You just couldn't do that. It's beyond anyone. You can't do it. That's why so many countries around the world stop contact tracing at 50 cases. 50 cases a day. So it's got to be a fair fight as well. And I'm confident that we've got the systems and processes in place to actively suppress, but you've got to get the numbers to a low level first. Otherwise, you're really asking people to do something that you know, as you ask, cannot be done.
Would it be fair
You're
to
speaking
say this
about
will be more conservative easing out than last time?
Look, I don't think you can compare it. A fair question, but I have thought about that issue many times, many times, for hours. And I don't think you can compare it because the differences between the first and the second wave are so stark in terms of where the virus is, how it's transmitting, how much community transmission there is, the interplay between large households and high-risk workplaces. All of those things have to be factored in, and I think it makes it unique in some ways. That's why we're going to try and give people on Sunday a traffic light system, so a series of phases. We'll provide some dates where we can. There will be other things that are so far off, and again, I hope that, I think we all do appreciate that a week is a long time in this thing, a day is a long time in this thing. So even a month or two is a very long period of time when it comes to fighting this battle. So we'll provide as much detail, as much certainty of things that we're going to do, as well as a picture of things we hope to do based on the case numbers as they present over time. So that's what Sunday will be about.
Premier, you've said you want to be frank with us.
I'll certainly try every day to be frank, as frank as I can.
113 cases today. The reality is that means that the likelihood of coming out of stage 4 or in some shape or form next weekend, as some people believe may happen, isn't going to happen. Can you, I guess, be frank with us about that?
Well, I'm trying to be as frank as I can.
The numbers are so high.
Yeah, the time to announce what things look like in the weeks and months ahead is not today, because the work is not finished. And it can't be finished because you have to wait to get the most contemporary data. For instance, it's only a couple of days ago we had 70 cases. And you might well have, said, okay, well let's make a series of decisions based on that being the peak. Well, 2 days later, we haven't got 70 cases, we've got 113 cases. So I know it's frustrating, and I know that because all that work is going on, there is a legitimate question, well, why can't you announce everything today? And the answer is because it isn't ready, and it doesn't mean anywhere near as much as it will mean, or be as certain as it will be on Sunday, because there is a program of work and that work isn't finished.
I guess I'm not asking you to say when. I guess there is some people out there who have this belief that stage 4 is meant to end next weekend.
Sure.
That's not the reality, though, is it?
Well, again, I don't want to be playing word games, and I don't think we're in disagreement. We're not in disagreement. What I'm saying to you is, it is too early for us to be giving people a definitive sense of what the weeks and months after September the 13th look like. We will do that on Sunday, but I will make, in direct answer to your question, I will make the point, as I have a few times, that if this is not done in a safe and steady way, and it's not done over time in a gradual way, then it just won't work. And we will finish up with numbers exploding and arguably in a worse position than we were, 4, 5, 6, 7 weeks ago. I don't want to get to a situation where frankly people are looking at the board every night at 10 o'clock when I get my phone call to tell me what's likely to be the number tomorrow, or when I stand up here every morning thinking, gee, those days of 700 were good, weren't they? And that's what will finish up happening. That is, I can't be any clearer than that. That's what will finish up happening. So, these are difficult judgments, but I also know there's great difficulty out there in the Victorian community, and we will seek to strike that balance between protecting lives, protecting livelihoods, opening up, but opening up so that it means something over a long period of time. We just can't have a situation, in my judgment, we can't have a situation where you get a couple of weeks of sunshine and then you're just into this spiral again, and numbers are going up and up and up, and it's not Christmas the way I want it to be, which is as close to a normal Christmas as possible. It'll be something very different.
Given everything you've just said since Lundy's question about how difficult this is, how precarious it's going to be, how hard the decisions are, is it tempting for you to start tending more towards elimination than suppression now?
Just to be clear, I wasn't asking for Victorians to feel sorry for us. This is our job. This is what we have to do. I'm just being as clear as I can. It's challenging. It's very challenging, and there will always be a series of options. And ultimately, no strategy that gets put to me, either that already has been or that will be in the coming days, will have zero risk. There will always be a residual risk that this gets away from us. You've got to choose the option that is the fairest and best balance between jobs and opening up and people finding that normal, but also the lowest risk possible of the whole thing spiralling out of control. The strategy has not changed. It is still an active, aggressive suppression strategy, whatever term you want to put on it. There's different ways to define that. I'll just take you back to comments the Prime Minister made a couple of months ago about the fact that low to no community transmission is something that has to guide us. But all of those fine judgments, they haven't been made yet, and they will be. But then, of course, we'll have to monitor. We'll have to monitor each and every day, each and every 7-day average, so on and so on, as we move through those phases of opening up. Because, of course, whilst we'd love to have a set of rules and then think that there'd be a static response, it just won't be.
Does that mean then you're going to be putting together a plan, or at least finalising a plan on, say, Saturday night to announce on Sunday morning? And if so, where's the certainty going forward? If we can't be certain about anything today, how can we be certain about anything on Saturday and Sunday?
Well, there's a whole lot of modelling that isn't finished yet, Noel. And this is something I didn't necessarily think that I'd become kind of a semi-expert on, but these sims to run it through the machine, as it were, it's not done in an hour. It takes 24, 36 hours. That's how many different inputs there are. And we don't just run it once. We run them multiple times at multiple places, using the very best of that whole field of science. That'll come together in the next few days, and then there'll have to be many long meetings over the course of the weekend, and then I'll make announcements on Sunday. And again, I'm again trying to be as clear as I can be. It's not like I'm going to be able to give people a calendar with every single day and every single step. There will be things we can announce with certainty and put a date on it. There will then be other things that are where we hope to be and what we are working towards. And those latter things, and sadly, latter can be a month or six weeks. That's an eternity when it comes to this thing. They will all be based on the case numbers as they present, subject to, of course, those initial opening up steps. That's all for Sunday, and I think you can appreciate that. You've got to do these things when you've got the most information, as much certainty as you can bring to a completely uncertain task, and you have to be guided by the data and the science and the best of medical advice.
How old is
Given that
the
you've said that
draft
these
that was being
documents
published
are
this morning?
legitimate, and you've said although out of date, that's fine.
What? Sorry?
And sources close. So the plans,
Yep.
the plans on the Herald Sun today.
Yep.
You've admitted it's a legitimate document, although you've said out of date. Sources from your office last night confirmed that it was a document that was largely accurate as of Wednesday, with small changes likely to be implemented before the announcement. So based on that, do you foresee any big changes to stage 4 lockdown between September 14th and September 28th? And in terms of the thresholds of the 5 daily cases and the 3 mystery cases over 14 days, is that likely to change, and is that out of step with other states?
Just the last part again, Alex. Sorry, I didn't quite.
Well, we'll do the first one.
Sure.
Double pronged.
Yeah, I'm not here to foresee or foreshadow. I'm here to tell you that the announcements will be made on Sunday. That's the first question.
Yep.
The second one?
The threshold for stage 2, 5 daily cases, 3 mystery cases over a 14-day period to allow shops and hospitality to reopen.
Sure.
Is that threshold likely to change, and is it out of step with other states?
Well, that document has no status because the decisions have not been made. So I'm not going to pick apart different elements of it. In terms of what different phases will look like as it relates to retail, for instance, or hospitality, or those workers that have been furloughed and are not working at the moment under stage 4, we will outline each of those steps, industries, movement, notions of people coming to your home and the circumstances under which they can, curfew, all of those things will be the subject of the announcements we make on Sunday. But again, what I'm trying to do is to be as absolutely direct as I can. You know, we're not going from these settings to just completely opened up on the 14th. We simply can't. We've got to bank all that we have achieved. We've got to make sure that counts for something, and that it can be translated into a long-term set of rules, a long-term stable and defendable number of cases until a vaccine comes. I know that is not exactly what everyone wants to hear. I get that. That is the frustration of this thing. It is stubborn. It will not be easily defeated, but it has to be defeated properly in the second wave, or it'll just be back, and it will be back with a vengeance. Be in no doubt about that.
A growing number of doctors and medical experts are calling for lockdown to end on September 13, as they expected there will be a rise in cancer fatalities as well as other diseases, as they're probably going undiagnosed because people are too scared to visit the doctor out of fear they'll contract coronavirus. Are you taking this into account when you announce your...
Yeah, look, we take into account all the impacts of fundamentally changing the way Victorians live their lives, whether that be in employment, in accessing services. And we've stood here many times, I think, talking about many of those issues. The issue of cancer screening has been raised at National Cabinet. Every effort's being made to try and drive those rates back up to closer to normal levels. I don't want to be seen to be commenting on those doctors. They're free to have a view. They put their view yesterday. They essentially tried to make the case that the death numbers are quite low. therefore we should open up. I have to respectfully find fault with that logic. The notion that a death rate whilst you're locked down can be assumed to continue with some stability once you open up, I just don't think that makes a lot of sense. But I honour the work that they do. I completely support their right to have a different view to me and a different view to other doctors who are working with us. I would also make the point that as committed and as passionate, and I have more than some personal experience with those who provide cancer care, and I've got nothing but the highest regard for them, and I indeed know many of the doctors that have signed that letter. There'll be no room for any of their patients if our hospital system is completely overrun, and that's what will happen if this thing gets away from us again, and is potentially, the third wave is potentially worse in terms of numbers than what the second wave has been.
The Prime Minister is
Premier,
keen
Victorians
to...
who might be feeling a bit flat today to see the numbers back in triple digits. I mean, you know how closely people
Indeed, yes, that's right.
What's your message to them?
My message is this strategy is working, and we have to stay the course. We have to make all that we have given, all that we've done, all the sacrifice that every single Victorian has made has to count for something. We can't just let that be washed away by opening up too quickly. We've got to do this in a safe and steady way. That's what the science tells us, that's what the doctors tell us, that's what the data tells us. And as difficult as that is to hear, there is no alternative. We've all got to look out for each other, and we can be positive about the fact that this strategy is working. But it is a wicked enemy. It's not easily defeated. It spreads rapidly, it spreads silently, and a bit like a bushfire, it needs to be put out, or to such a low level that we can safely suppress it. We don't want the thing flaring up again and potentially running wild. That will benefit nobody. That will benefit nobody. That's why it was so important on Monday that I indicated that we would be finalising all of our work throughout the week, and we'd have more to say on Sunday. That plan hasn't changed, and we will make those announcements on Sunday.
Prime Minister is
support a
keen
national-
to create a national definition of what a hotspot is.
Correct? Yes.
How open are you to that idea?
I've spoken to the Prime Minister about that at length on Monday night, and I made some comments, I think, Tuesday, Wednesday, in relation to travel and where I hope to get to. I think that it is not beyond us as a nation. This is me speaking on behalf of Victoria. I'm not a commentator on what other premiers might think. This is my view. I don't think it's beyond us to get a nationally agreed set of terms where we can all, in a unified way, say, right, there's a problem in suburb X or city Y, no matter where that might be, and have an appropriate public health response to that. There were some questions asked yesterday about asymptomatic testing. I've had a conversation with the Prime Minister about, particularly with some of the advances in testing, and Alan referred to, following Rich's question, about those very rapid tests, an hour or so, perhaps even less. Now, I'm not promising that that happens tomorrow, but we're doing the trialling of that. Our system is working that through. At the moment, there's nothing more valuable than a positive test. That's what we're after. But there may come a time when negative tests are almost as important, and for the purposes of travel, for instance. I think if we all work together, and we're all focused on being as safe as we can and finding that COVID normal, then I think that we can absolutely do that. And interstate travel, whether it be for work, for holidays, all of those sorts of things, we'd all like to think that there was a much greater freedom of movement by the time we get to the end of the year. That's our hope. Whether we can't promise that, but the best way that we can get the borders to our state open and have movement in and out of our state is to drive these numbers down to very, very low levels, and then not open up as if the thing's gone away or that a vaccine has turned up. It hasn't. And this virus has not gone away, and it has got to be done safe and steady and done right.
So you're saying we should have a national approach to border restrictions as well?
Oh, look, I think the Prime Minister's been very keen to achieve that. I understand why he wants to achieve that. But again, I think I'd hope you'd give me some credit. I've made the point many, many times. I'm not here to criticise other premiers. If I were in their situation, I probably would have made exactly the same judgments that they made. So I'm not criticising them. But at some point, when we have successfully seen off this second wave and locked in that long-term COVID normal, then that'll be the time for them to maybe revise some of the decisions they've made.
Premier, can you tell us how how old this document is that's being circulated this morning?
I can't tell you because there are, as Alan said, there are many, many documents, and it's not a document that's come to me. It's not a document that's come to Cabinet. It's not a document that has any status. There are literally, I'm not sure whether Alan said dozens or hundreds, or there's lots. There are lots of different working documents because there are lots of different options here.
So you've never seen that one?
No, it's not a document that's come to me or come to Cabinet, and it has no status. We will make announcements on Sunday, and then we'll be able to have a discussion about all the decisions we've made. Challenging decisions, but really important decisions that we get it right.
So will Cabinet meet on Sunday morning?
Cabinet will be meeting in lots of different times. There was a lengthy meeting last night. There's another one today, and then there's a whole bunch of meetings go on before and after that. It's going to be a very busy few days. Although that's not out of keeping with the way the last 6 months or so have gone. Well, indeed, most of 2020.
So do you expect the majority of that document to change by Sunday?
I can't comment on those matters because it's not a document that has any status, and it's not a document that has been provided to me or been the subject of any consideration by Cabinet. They are. I think I've been clear. There are many different documents. There are many different options, and the really tough part about this is we have to choose the right one, and then all of us as a community have to lock in behind those choices because they're the ones that the science tells us. Not a matter of opinion, it's a matter of scientific and public health fact. Where we'll land is the place that gives us the greatest chance of making sure every sacrifice that's been made counts for something, and that we can lock in a COVID normal for the long term.
Given that you've said it won't be a date on the calendar and it will be done.
There'll be some dates, but it won't necessarily be, for 5 months.
Yeah. So foreseeing that there is the possibility that we might be staying down in lockdown for longer, and that some people's work lives and personal lives will be affected by that, will there be more rounds of assistance for Victorians from September the 14th?
Well, we'll have further announcements to make about all sorts of different matters, whether it be about the rules, about our response, about the budget to be delivered later in the year, where a very significant focus, an absolutely unprecedented focus on investing to save and create jobs will be a feature of that. But that isn't for today. That'll be at a later point.
This has just come through that
Sure.
On the aged care deaths and the discrepancy in reporting, I'm not
Yes.
sure who this is for, but apparently there will be more discrepancy as they kind of play catch up, I guess. Should we expect higher death rates from the aged care sector as a result of reporting tomorrow?
Not that I'm aware of. Not that I do not know what the number of reported deaths for tomorrow will be. As soon as I do, which is usually only half an hour or so before I stand up here every morning, I'll report them to you. And if we've got details, as we have all week, where I've been very careful not to stand here and have you all believe that a number relates to yesterday when I know that it doesn't. If it relates to an earlier period, then we've tried to be as upfront as we can. And that is nothing more or less than trying to reconcile to one single source of truth the different reporting that goes on, and the fact that the Secretary of the Federal Health and Aged Care Department, Brendan Murphy, has written to all private aged care providers and said, righto, everyone needs to make sure they report. That's changed some things, and we're just reporting that as faithfully as we can. So I can't rule out that there might be more of those tomorrow, and I certainly can't predict, regardless of when they occurred, I certainly cannot predict that there won't be, tragically, more people reported tomorrow that have passed away, whether they be in aged care or in any other setting. Any other issues?
Very last one, please.
Sure.
Online.
I'll just tell them that I couldn't get to question time on time because you kept me here. That's fine. I'm sure they'll understand.
Well, this one's more just that some of the crossbenchers that supported the state of emergency are getting a lot of abuse online, and some of it pretty horrible.
Yeah. There's no place for that. There's no place for that. Ultimately, they're doing their job. They're having to make difficult decisions. We all are. And I just say to those who are behaving in that way, there's no place for that. And more broadly, for those who aren't behaving quite like that, but may not agree with the decision that those crossbenchers have made, I would just say these are a set of rules to allow us to open up. They're not a set of rules to keep the place shut down. And without the certainty, for instance, of making sure that someone who's got this virus stays at home away from other people, how can you fight this thing? You simply can't. We can't do this on an informal, voluntary basis. There does need to be a structure, and that's all the extension of the 6-month state of emergency does, in 4-week blocks based on the best of medical advice. And the day that the Chief Medical Officer says to me that we don't need to extend the state of emergency will be a day that I'll be very, very pleased to report that. Very pleased.
And Father's Day.
Father's Day, and you've given me all this time to think about it, because you asked me.
Yeah.
I even to the point where I announced to my kids on Saturday that I hope they were looking after me on last Sunday, because your question got me all confused that it was last week.
It's my favourite day.
Father's Day. Father's Day is a very important day. It's going to look very different this year, I know that. But unless it does, then other significant days like Christmas Day will not be anything like normal. That's what we're working towards. Father's Day is a very emotional day for a lot of us, all of us really, in one way or the other. And I'd ask kids across the state to spoil their dad, albeit it might be in a different way than you normally would. But let's all reach out and look out for each other and send our love and support to dads. Dads are great. How does that sound, Alex? Very good? Excellent. Any other issues? Thanks very much. We'll see you tomorrow. Seriously, I thought it was last Sunday.
Get it?
No.